Today, we follow two cases as they are treated by Dr. Bunag, an ER doctor, Dr. AÑOS, a hematologist, and Miss C, the hospital's pharmacist. HS is a 5-year-old boy from Tondo, Manila, accompanied by his mother. He comes in with a chief complaint of fever of 4 days duration. This was accompanied by a severe headache, malaise, and occasional cough and colds. One day prior to consult, patient's mother noted a rash on his face and chest. He is also able to drink adequate volumes of water and no change in urine was noted. She reports other children in their area as experiencing similar symptoms. Further evaluation revealed a positive tourniquet test and positive dengue NS1 antigen. His CBC result is as follows.
The other patient is LG, a 60-year-old female who came in for severe pain on her left leg. The pain started 4 days prior to consult, which was initially described to be throbbing and cramp-like. The pain was sudden in onset, and she denies any trauma prior to the pain. The pain was persistent and increasing in severity over the next few days. 3 days prior to consult, she noticed swelling and redness in the same area. She also noted that her left leg felt hotter than the rest of her body. The pain was further aggravated by standing and walking. On the day of consult, she noticed that the tips of her toes were turning blue, and the pain reached its peak severity of 9 out of 10. She has no history of hypertension or diabetes, and she mentioned that she received heparin 11 days ago for her upcoming hip replacement surgery. Physical exam revealed a swollen erythematous left leg that was tender to touch. Left lower extremity cyanosis was noted on all 5 toes, while erythema and necrosis was noted on the heparin injection site. Her CBC result is as follows, with the most notable finding being a low platelet count, while all other parameters are within normal range.
During infection, there is diminished platelet production and increased platelet activation or turnover, both of which can cause thrombocytopenia.
Thrombocytopenia is decreased platelet count. If the normal count is from 150 to 450,000, these patients have platelet counts even lower than 100,000. We've seen patients come in due to the complications of thrombocytopenia, like LG. A number of them present with deep vein thrombosis.
For the case of HS, one of the complications of dengue infection is thrombocytopenia. During an infection, the spleen harbors numerous platelets, and the immune-mediated platelet activation is triggered. This, along with the following mechanisms, would cause a decrease in platelets in the blood. Another mechanism is diminished platelet production. Infections can cause direct bone marrow suppression or increased peripheral platelet consumption, leading to thrombocytopenia.
So, Doc, what could have caused my son's thrombocytopenia?
In HS's case, his thrombocytopenia is associated with dengue virus infection. Dengue triggers the activation of platelets. Studies have shown a high number of dengue virus copies in these activated platelets. There is a suggested direct correlation between the activation and depletion of platelets. A sharp drop in platelets is usually seen on the 4th day of fever. Dengue infection has also been found to activate the intrinsic pathway of apoptosis.
Thrombocytopenia may also be caused by other diseases aside from dengue. Liver damage and hepatitis C may have mild degrees of thrombocytopenia due to reduced production of thrombopoietin. Immunologic thrombocytopenia is also seen in HIV infection. Other systemic viral infections, such as Epstein-Barr virus and cytomegalovirus, rickettsial infections, and bacterial sepsis are often associated with thrombocytopenia.
What patient LG experienced was a consequence of heparin-induced thrombocytopenia, or HIT. HIT is an immune-mediated process. First, heparin binds to inactivated platelets. It binds to these platelets by attaching to the protein PF4 on the platelet surface, forming the heparin PF4 complex. After around 1 week, the body forms antibodies for this complex. Thus, patients only experience HIT 5 to 10 days after therapy is started.
Binding of the antibodies results in two things: destruction and activation. Let's start with destruction. Binding of the antibodies to the complex tags the complex and marks it for destruction. Platelets decrease because they are being destroyed by the spleen. At the same time, binding of the antibodies can activate these platelets, which, when activated, release microparticles. These microparticles are prothrombotic. More platelets activate and aggregate, leading to coagulation. Platelets decrease because they are being consumed.
I was told that thrombocytopenia, which my doctor warned me about, is really a possible side effect of heparin. Are there other drugs that can also cause this?
I work at a local pharmacy and get this question all the time. There are other drugs. These drugs can either decrease platelet production or accelerate platelet destruction. How can drugs decrease platelet production? They can target the factory that produces these platelets, your bone marrow. Let's ask Doc Bryce about the drugs given to suppress the bone marrow.
I usually give these drugs to my leukemia patients. As you may have guessed, these are chemotherapeutic drugs. However, there are other drugs such as anticonvulsants and diuretics that increase platelet production. If a medicine prevents your bone marrow from making enough platelets, the condition is called drug-induced non-immune thrombocytopenia.
However, if a medicine causes your body to produce antibodies, which seek and destroy your platelets, the condition is called drug-induced immune thrombocytopenia. It's not just heparin. There are other drugs that induce these antibodies such as NSAIDs, antibiotics, and even the anti-malarial quinine.
What do we have to do to help my son recover faster?
We first need to classify which dengue case your child belongs to, since our management will be tailored according to the appropriate classification. The patient may either be sent home, Group A, be referred for in-hospital management, Group B, or require emergency treatment and urgent referral, Group C. Based from the clinical presentation and the labs of your son, he is classified under Class A.
Usually, for immune-mediated thrombocytopenia, as long as the viral infection is resolved, thrombocytopenia resolves spontaneously. If his platelet count still drops below 50,000, HS should be immediately given platelet transfusions.
For now, we advise that he is given adequate bed rest and frequent oral fluids. You can give him oral rehydration solution, soup, or fruit juices so that we can prevent electrolyte imbalance. We can also give paracetamol for his fever, not more than 3 to 4 times in 24 hours. We cannot give him the following drugs, as they may aggravate gastritis or bleeding.
That would be great, Doc. Since we'll be going home, what things should I watch out for in my son's condition?
Yes, there are things that you should watch out for. And remember to bring HS back here should these symptoms occur.
Thank you so much, Doc. I'll make sure to note these things should they appear on HS.
What about me, Doc?
First, we're going to stop heparin. We can consult Dr. Bryce for alternative anticoagulants that may be given to you.
There are a number of alternative anticoagulants you can take, such as lepirudin, fondaparinux, or rivaroxaban. These work to both prevent and treat thrombosis.
Until when will I have to be treated? Will I need any other treatment aside from an alternative anticoagulant?
We'll be constantly checking your platelet count. You will be treated with the anticoagulant until your platelets return to normal levels. You won't need a transfusion. However, do note that for your deep vein thrombosis, we'll also be using a catheter to deliver the drug directly to the thrombus.
Sorry, Doc. I forgot to ask. What will happen to my son? I'm really worried because I had a neighbor whose daughter almost passed away due to the complications of dengue.
Well, given that your son is receiving the appropriate management, he has a very high chance of fully recovering. In fact, dengue fever is a self-limiting disease, meaning our body can recover from the disease and we just have to give the appropriate supportive treatment that I have mentioned a while ago. The mortality rate is less than 1%.
How about me, Doc? What's going to happen to me now?
Your condition is reversible when we discontinue the drug heparin. We are expecting your platelet count to increase within 1 to 2 days from drug discontinuation, and we are hoping that it will reach normal levels within a week from discontinuing heparin.
Well, while heparin-induced thrombocytopenia generally has a good prognosis, it can still be unfavorable for some patients. According to one study, patients who have HIT had a 20% in-hospital mortality rate regardless of thrombosis development, and minority of the patients may have more prolonged thrombocytopenia after heparin is discontinued.